and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't, day after day, often without proper protective equipment. Despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
Good evening and welcome to our viewing audience. Thank you for joining us in the celebration of the International Year of the Health and Care Worker. I'm Tanya Macfall-Major.
And I'm Brittany Jones.
And we will be your co-host for this evening's award ceremony. Under the theme, Protect, Invest Together, the year 2021 has been designated as the International Year of the Health and Care Worker in gratitude for their steadfast commitment in the fight against the COVID-19 pandemic.
In the Bahamas, the need to invest in the education, employment, and working conditions of health and care workers is a priority, not only to improve health outcomes, but also to improve job and economic opportunities. The resounding call for action throughout the year 2021 is to ensure that the health and care workers are supported, protected, motivated, and equipped to deliver safe health care during and beyond the COVID-19 pandemic. Echoing these sentiments, hear the remarks of Dr. Tedros Ghebreyesus, Director General of the World Health Organization, calling for us to listen to and amplify the voices of health and care workers.
Distinguished guests, dear colleagues and friends, health workers are at the forefront of any disease outbreak. They are every country's most valuable health resource. Across the world, health workers have shown unwavering dedication during the COVID-19 pandemic. In appreciation of these efforts, 2021 has been designated the International Year of Health and Care Workers. We have a moral obligation to protect our health workforce. We must learn from the pandemic, implementing policies and making investments that lead to better protected and supported health workers. Let's listen to our health workers and amplify their voices. More than anyone, health workers themselves know what they need to be safer and healthier and ultimately more effective at their jobs. They know what it will take to end this pandemic and to prepare for and prevent future disease outbreaks. I salute every health worker. Thank you for your relentless dedication and commitment. Thanks to you, the world is a healthier, safer, fairer place. I thank you.
To demonstrate our care and appreciation this evening, we recognize and commemorate the hard work of the health and care workers across multiple professions, departments, and islands. This is the story of heroes behind the mask.
My most profound moment was when nurses from all cadres and all specialties came together to be able to deliver quality patient care for the patient diagnosed with COVID. We also had a broader relationship with our other partners, our physicians, our laundry department, our lab. Everybody came together to be able to do what needed to be done to deliver the care that was needed.
There's numerous medical equipment that we have to take care of. A complexity of devices such as ventilators, beds, high flow machines. I mean, it's very intense. When you get a service call and you have to respond in the environment of care, put on your PPE, go in the actual patient room and work on these equipment.
Going into uncharted territory, didn't know what COVID was, didn't understand it completely. I think no one did. And, facing the patients and the doctors and working with them, experiencing a new thing in nursing.
My most profound moment is working with the Samaritan Purse Project, where we had to install some tents with our foreign guests. We had some experience working to the rain, on timelines, and the tents are not just ordinary tents. These are some high maintenance tents where we have to constantly, every day, check the air pressure, put in the safety features and all of the different devices, the keep the distance, the safety distance, put in other apparatus for safety and stuff like that. It was fun, challenging, but it was fun.
I could say my most memorable moment is working in the critical block. I work in all the areas inside the hospital, but the critical block is the most, memorable because, those patients are critical. They cannot really, do for themselves like that. So that's the area where we really monitor, like really top of our game, I should say, because it have to get sanitized, wiped down, and it's always have to kept, on point.
Hi, I'm Dr. Latoya Storr, Senior Registrar here at the Round Memorial Hospital Accident and Emergency Department. During the COVID pandemic, we have been challenged with a lot of patients coming in needing emergency care. Oftentimes, we have had issues with places even to see patients. However, although our team has been working relentlessly and tirelessly, we are still committed in providing excellent service and care to all the patients that come through our institution.
There were certainly many profound moments. It's been a long haul. As a frontline worker, I certainly remember I was there and took the first patient to X-ray. I was there when the patient from Bimini came in who later died. It's been challenging, just dealing with the volume of patients. And then persons are looking to you to solve the problems, to guide. And it's ever-changing, and you have to try and keep up and give the best guidance.
My most memorable moment while serving at this public hospital and on the COVID response team were moments that actually required me to take off the role of physician and put on the role of a Samaritan. In other words, moments that required me to show my humanity.
Well, it all comes from having love for what you do and love for the clients, because that's what we come here to do, you understand? So if you see it, if it's necessary, do it, and it's simple.
Some of my experience with the COVID-19 pandemic has been, first of all, we were being trained how to properly don and doff our personal protective equipment to ensure that we would be as safe as possible when we were interacting with our colleagues as well as patients or any body fluids specimens from patients. So that was important.
When the first patient came through our doors, COVID positive, I was the duty sister assigned to night duty when I get a call from my staff for urgent assistance. At that time, I had to transition from being a nursing officer to that being a care and a good Samaritan to provide quality patient care for the patient.
What I can say that is most profound is the massive training that the Infection Prevention and Control did. When COVID first began, or prior to COVID that is, we embarked upon a massive training within the institution, whereas we targeted physicians, nurses, frontline workers initially, and then we involved and included the other departments within the institution.
Trying to maintain services for outpatients that access services at the Princess Margaret Hospital. What you need to understand is central accessionings is an area where we do blood draws, and a lot of persons needed those services. So we had to ensure that they were always available for the outpatients.
Well, my most profound moment would have been surprised to see the amount of persons that have passed during the COVID pandemic. During the first wave, there was about one per day. The second and third wave, we have seen numerous deaths. And it's really been surprising, frustrating, and tiring, honestly speaking, because the amount of persons that don't take the pandemic serious is frustrating. And I feel sorry for the families that have lost many loved ones during this time. And so, it has had a profound effect on the way we work, the way we think about life, the way we do things in our department, because it has pushed us to the point where, we love our job. We won't stop, even though we feel like stopping, but, it has had a profound effect, greatly, I must say.
In the midst of all the uncertainties, my profound moment is when our already short-staffed, the food service department, rise to the challenge to provide meals for patients and staff at the South Beach COVID Center. This was all new to us. So at that moment, I felt a sense of pride and honor to be working with such a dynamic team, working together to meet the needs of our patients.
My most memorable moment was just the process of transporting the specimens and seeing the amount of specimens. You would hear people talk about it, but actually seeing the large quantity of specimens coming in with different percents, that was an experience for me to remember. The importance of transportation and PMH that is making sure that the specimens are brought to the various areas, research labs and so forth like that in a timely manner in order for the patient to be processed and for the doctor to know exactly what's wrong with the patient.
Accepting the award on behalf of Air Ambulance Services, Captain Jason Sweeting.
We at Air Ambulance Services are honored to be recognized by PAHO-WHO for the essential emergency services we provide in the Bahamas for the last 22 years, and particularly during this COVID-19 pandemic. The government of the Bahamas, together with teams of dedicated health professionals at the Ministry of Health and Civil Aviation, have been partnering with Air Ambulance Services, allowing us to deliver quality standard health care to all our family islands. We wish to thank our 31 committed team members who provide exceptional skill and expertise with pre-hospital care and air medical transport across the archipelago, southern United States, and regional British dependent territories.
Accepting the award on behalf of the National Emergency Medical Services, Mr. George Burrows.
Let me begin by expressing profoundly, on behalf of my colleagues here in the Bahamas and all frontline workers, gratitude and thanks for the expressions and recognition of thanks. Every day prior to this pandemic and since COVID-19, we have aspired to be fully present giving the best of ourselves to our patients and to each other, being our brother's keeper. We will continue to always give our best with hope of a better way out of this pandemic. Once again, with gratitude, I said thank you.
Accepting the award on behalf of the Bahamas Nursing Council, Nurse Patricia Newbold.
On behalf of the Nursing Council, the Commonwealth of the Bahamas, I accept this award with gratitude. And it is ironic that the year 2020 and the year 2021 have been recognized as the year of the nurse. And on behalf of the Nursing Council, which is the regulatory body in the Bahamas that regulates nursing practice and nursing education in this country, we are here to say thank you. We do appreciate everything that the nurses have done, the healthcare workers as well as the caregivers, as we have been challenged at this time. And so we say on behalf of the Nursing Council, thank you to all of the nurses, and we admonish you to please remain safe.
Accepting the award on behalf of the Public Hospitals Authority and Grand Bahama Health Services, Ms. Catherine Weech.
I take great pleasure in accepting this award today on behalf of the almost 4,000 healthcare workers throughout our healthcare system. The year 2020 has transformed the way we provide care to our patients and by extension how we serve the wider community that access our services. Our healthcare workers have gone from being afraid of the unknown of the coronavirus pandemic to healthcare workers who now understand that work changes are required to treat these vulnerable patients in order to protect themselves and their families. The words, "the heroes behind the mask," certainly represents the early heroes in the PHA who volunteered to serve when other healthcare workers were afraid. We owe a debt of gratitude to all healthcare workers in the PHA. And so on behalf of the Board of Directors and the Executive Management, I say a heartfelt thanks to all of you.
On behalf of the administration and staff at the Rand Memorial Hospital here in Freeport, Grand Bahama, we are honored to accept this award and recognition. We would also like to say thank you to the staff at the Rand Memorial Hospital for their hard work and effort during this pandemic.
Accepting the award on behalf of the Bahamas Pharmacy Council, Ms. Shagregor McPhee.
The COVID-19 pandemic has been one of the most challenging events to affect the world, specifically the healthcare community in more recent times. In the Bahamas, the pharmacy community has been at the forefront of this battle, alongside our brave nurses and physicians, going to work day in and day out to ensure that our patients have immediate access to the treatment and care that they need. The Bahamas Pharmacy Council, as the regulatory body for the pharmacy profession in the Bahamas, has constantly sought to ensure that the pharmacy community is providing the Bahamian public with the highest standard of quality medication, that our pharmacies are staffed with competent professionals who are constantly staying up to date with all forms of treatment modalities for COVID-19 to ensure that Bahamians are afforded first-class treatment in an effort to battle this pandemic. On behalf of the executive members of the Bahamas Pharmacy Council, we wish to thank PAHO-WHO for taking the time to recognize our efforts and extending their gratitude for our services in these most serious and trying times.
Accepting the award on behalf of the Department of Public Health, Mr. Therese Ellis.
It is indeed an honor and privilege to have been given this opportunity by my colleagues to express our thanks to the World Health and Pan American Health Organization to acknowledge their dedication during the world's worst pandemic. Due to the virus's high transmissibility, making it a significant public health concern, PAHO-WHO is to be highly commended for the part played in recognition of the work of healthcare workers who have also been impacted by the coronavirus, as they diligently executed their duties to the patients for whom they are obligated to care. The Commonwealth of the Bahamas is a unique archipelago comprising of 700 islands and keys. It is my privilege to say that thank you to the Pan American Health Organization's Bahamas Local Office on behalf of the Ministry of Health and Wellness and the Department of Public Health for affording this opportunity of continued partnership. Thank you, healthcare workers in the Bahamas and globally. You are the heroes behind the mask.
Accepting the award on behalf of Princess Margaret Hospital, Dr. Hilary DeVoe.
On behalf of the PMH COVID team, I would like to extend our deepest gratitude to PAHO and the WHO for the honor and acknowledgement during International Year of the Health and Healthcare Worker. The past 18 months has been extremely challenging, mentally, physically, and emotionally. While I'm accepting this award, this truly belongs to every physician, nurse, porter, and housekeeping member of the team that has had to interact with COVID patients during this difficult time. I could not do my job without the help of these amazing and selfless people. While we are all exhausted and spread extremely thin, the war is not over. We still have a lot of work to do before this pandemic is behind us. Let's continue to give the best care we can to our patients.
Accepting the award on behalf of the Emergency Operations Center, Dr. Monique Mitchell.
It is with heartfelt gratitude that I receive this plaque on behalf of the Minister of Health, Dr. Michael Davil, the Chief Medical Officer, Dr. Pearl McMillan, and the more than 50 dedicated officers who served on the EOC. Thank you for recognizing and acknowledging the long hours of sacrifice and valuable contribution of the EOC in the response to COVID-19. This is a group who is often overlooked because we don't seem to be on the front line. We appreciate this gesture, and it will no doubt encourage us to continue in the battle to overcome COVID-19.
Accepting the award on behalf of the Bahamas Health Professions Council, Dr. Richard Knowles.
The global pandemic has highlighted more ever than before the need for qualified, competent healthcare workers. PAHO's recognition of this through today's award speaks to its commitment to support and promote the hard work these professionals do daily to make the world and the Bahamas a better place. The Health Professions Council has had an unwavering charge to ensure that the healthcare professionals are well able to meet the demands of their respective professions. We wish to thank PAHO for this award and recognize the Health Professionals Council for desire to protect, invest, and work together in order to care for our country and support our healthcare workers. Thank you.
Accepting the award on behalf of the National Health Insurance Authority, Ms. Christy Butler.
To our devoted healthcare workers, thank you for all that you are doing. We may never understand the magnitude of all of the sacrifices that you are making daily to save lives, to ease pain, and to create a better future. Thank you for putting yourself in harm's way to save us, the public. You are truly the heart and soul of the war against COVID-19. Because of your efforts, I can trust that our community will stay safe during this unprecedented crisis. Your knowledge, bravery, and empathy are truly appreciated.
Accepting the award on behalf of Doctors Hospital and Doctors Hospital West, Dr. Sheena Antonio Colley.
We see every day our healthcare workers come to work and show up. They show up and they do a job but they do it with heart and with dedication, putting themselves at risk every day on the front line for the community. And we just would like to say that we will continue to uphold our frontline and healthcare workers in their mental, physical, and any other capacity that the health system can participate in.
This next award is presented to the Bahamas Medical Council.
The Bahamas Medical Council thanks you for the recognition given by the Pan American Health Organization and the World Health Organization in appreciation of healthcare workers. The Bahamas Medical Council was established September 30th, 1974 to ensure that physicians practicing in the Commonwealth of the Bahamas are qualified to provide standardized quality care to persons living in both rural and urban settings, oftentimes resource-constrained communities. Over the course of 47 years, we have increased our workforce by more than 100%. Today, we have tertiary care facilities on 2 main islands and more than 86 primary healthcare clinics and numerous satellite facilities across 726 islands and keys in the Bahamas, spread across 100,000 square miles of the Atlantic Ocean. Bahamas Medical Council works closely with other Caribbean and regional medical regulatory authorities. Recently, with PAHO's intervention, the Bahamas Medical Council credentialed many volunteers to assist with Hurricane Dorian disaster relief. We thank PAHO for their enduring support to the work of the Bahamas Medical Council.
Health and care workers are the heartbeat of the healthcare system. Their valiant efforts on the front line, treating patients, battling COVID-19, are deeply appreciated. Many of them made personal sacrifices and put their own lives on the line to keep us safe. Thank you for your service. Our expressions of gratitude for health and care workers will continue to be expressed for the rest of this year of commemoration and beyond. Our advocacy for your protection, physical and mental well-being, and professional growth will also continue for years to come. An investment in you is an investment in the resilience of our health sector to withstand future emergencies and other health situations of concern. We recognize the important role of support staff working alongside health and care workers and maintaining our healthcare systems. You too are to be commended. You all continue to play a pivotal role in our current battle against COVID-19, as well as in addressing health concerns that we faced before COVID-19, that we still face and will continue to face after the pandemic. We say a big and hearty thank you to you all. To every health and care worker, as you continue to fight the battle on the front lines to treat COVID-19 patients, I encourage you to also fight for your own life, to protect yourselves by getting vaccinated. In addition to the public health and social measures, vaccines are a most powerful tool in our fight against this virus. Together, we will win this fight, and we pledge to continue to protect you and to invest in you.
This brings us to the conclusion of our award ceremony in commemoration of the International Year of the Health and Care Worker under the theme, Protect, Invest Together. And we'd like to thank the viewing audience for your support. While health and care workers play a significant role on the front line of the battle against COVID-19, we all have a role to play. Together, we will overcome. Thank you.